but they didn't seem to be all that useful for people, Aboriginal people from remote communities in particular. A lot of the words weren't suitable for understanding for people, and they didn't translate well into Aboriginal languages. So for that reason, we had already identified that there was a clinical problem in how do you assess people for depression in a relatively straightforward way.
Professor Flicker, are you able to give me an example perhaps of how the assessment tool has been reworded or translated to better assist Indigenous patients?
Well, the language is much more easily identifiable as the local sort of terms. I'll give you some of the questions. In the last week, have you felt down, sad, or no good? Have you felt more tired or slack, like you've had no energy? So it was just translating the questions that are commonly used for everyone just into terms that people from Indigenous communities find more user-friendly. And the other thing that we did was we made sure that when they were translated, that they still made sense. So these questions have been translated and back-translated to make sure that when they're translated to Aboriginal language, they still make sense at that time as well.
Do you think that this will really improve diagnosis and improve identification of at-risk Aboriginal people suffering from depression?
Oh, absolutely. So one of the really common problems is that people look like they're not engaged or not disinterested in things, and sometimes those people are actually quite depressed, and people haven't had an easy way of assessing them. So this is just 11 questions. They can be done by virtually anybody. Certainly the clinic staff, the Aboriginal health workers, with a bit of training will be more than able to use this tool, and they'll be able to identify people who need further assessment. And that's a really important part. The tool doesn't make a diagnosis of depression, but it does indicate people who need to be seen by somebody about depression and make sure that they aren't depressed, and if they are depressed, that they should have treatment.
And what was the logic behind making this tool freely available to anyone at no charge via the website?
The reason being is that that's the best way of getting it out there. I think, and one of the things is that we want people to try and start using it and to start looking at people who are at risk and hooking them into services that they require. So it's no use just hiding it somewhere. We wanted to make it as freely available as we could. www.wacha.org.au.
What do you think this says about the willingness of organisations to change the way they approach and deal and deliver health for Aboriginal Australians by developing this tool?
I think we have to adapt our mechanisms so that people can access essential services. One of the problems is that we tend to stick to what we know best, and it doesn't necessarily work for everyone. For particularly remote living Aboriginal people, often the traditional ways that we've been using to assess depression, and people wouldn't follow it and wouldn't understand the questions. And the colloquial terms are really just the language of the people we're trying to assess. So it obviously makes sense, and it's useful, and it seems to work. So that's the important thing.